And we are so happy to welcome today Dr. Paz, who is going to walk us through a year or so like we have never had before. Doctor, you are experienced in the field of medicine. Just if you can summarize for us as you look back at the beginning of COVID and where you are right now, what has this year been like for you personally?
Colleen, it's been like nothing I have ever experienced. And I say that as someone that spent a good portion of my career practicing pulmonary and critical care medicine. And when this pandemic started early on, it was hard to imagine what the next 12 months would look like. And to know that we are getting to the other side, but we're not quite there yet, means that there's still work to do, and we can't let our guard down. But at the same time, being here at the Ohio State Wexner Medical Center has been extraordinary, and to see the response that's occurred here at the Med Center and across the community, just remarkable what has been accomplished in such a short period of time to address a once in a century series of events that none of us would have ever imagined in our wildest dreams, quite frankly.
I can remember at the beginning of the pandemic, first hearing reports coming out of Wuhan, China about this strange virus and watching that and thinking to myself, wow, I wonder if that would make its way to this country. I wonder what they're doing to keep it from getting here. When it got here, I remember quite distinctly thinking, well, we might be shut down for a month or so. You were looking at this from a scientific perspective. Did you envision how this virus spread and how it took hold of the world?
Yeah, it's a great question, Colleen. I mean, early on, we were looking at this through the lens of previous epidemics caused by similar viruses. So the SARS epidemic, the MERS epidemic, and the ability to, for an array of different reasons, see that those became contained. I mean, they were certainly spreading, and they spread across continents. And in the case of MERS, very deadly. But at the end of the day, there was a period of time when they occurred. It was much more curtailed and of a shorter duration, in a sense, from what we've all experienced. I don't think anyone early on expected it to become a global pandemic in the way that it has. And I think we continue to learn. For example, one thing that we're understanding a lot better now is how this virus mutates. And early on, there was thinking that perhaps this is a relatively stable RNA virus, not like influenza that mutates quite frequently, which is why vaccines are, we're very happy when they're 50% effective. We're now seeing that even this virus has the ability to, in a very significant way, mutate as well. So it's a never-ending process of learning more and more about this particular SARS-CoV-2 virus, about the pandemic in general, and how we have to address what we call this COVID-19 pandemic, which is caused by this very specific coronavirus, SARS-CoV-2.
When you talk about mutation, I think that's what a lot of people right now are finding frightening. It's almost as if the virus finds out what we're doing to stop it and changes its pattern to become something different. Is it something we can never fully get ahead of?
Yeah, so it's a great question, and again, we're learning in real time how to best address it. So, we have to understand that it's not one virus; it's billions and billions and billions of copies of the virus. And what happens is the virus copies that we have immunity to are not going to be successful. They're going to fail. But there's always going to be a mutation in one of the offspring viruses that we're not immune to, or only partially immune to. And that's the one that can grab a foothold and then continue to replicate and have progeny. And that's what we have to stop. The ways we do that include stopping the transmission. If we can stop the transmission of this virus, then we can stop this virus from replicating and propagating and spreading and developing offspring mutations, where there is a weakness in the immune systems of the entire population, and it can grab a foothold. And that's what we have to do. So what are the things that we're doing? Well, we've talked for a year now about social distancing, incredibly important, but even more important, wearing a mask. You know, this is something that I've talked about now for a year, which is to say that if we all wear a mask, not only do we stop, if we're a carrier, symptomatic or asymptomatic, we reduce the likelihood of us transmitting it to someone else. We now have really good evidence that wearing a mask protects us. And that's really important, depending on what kind of mask, which study you're looking at, 80% effectiveness. Now there are recommendations that we double mask. The reason that the recommendations from some about double masking is it helps protect us, extra filtration. If we can keep the virus from getting into our bodies, then we prevent us from becoming infected. We prevent the virus from replicating inside our bodies and us spreading it to somebody else, and with that, potential mutants. And of course, now the vaccines, extraordinarily important. Part of that public health armamentarium, that with the masks, with all the other appropriate social distancing and other things we put in place, will have the ability to stop this thing from spreading, this virus from spreading from one person to another. But we know that the vaccines, depending on which one we're talking about and in what setting we're talking about, and assuming that everybody is willing to accept the vaccine, is only one part of what we have in our armamentarium to deal with this virus. And I would add one more thing that we have to think about, which is we need treatments. And we have to develop better and better treatments for this virus. Because some people, and I'm hoping for a day where this virus, this SARS-CoV-2 virus, is no longer on the planet Earth. I truly hope that will be the case, and I hope it'll be soon. But just in case that is not the case, and just in case this does come back periodically, or there are hot spots that break out, and we've seen this, for example, with Ebola, where it's gone for a good period of time, and then there's a hot spot where it breaks out. That's one scenario. The other scenario is smallpox, where we can literally talk about eradicating it from the planet. We're not 100% sure which course this is going to take us, but we have to be prepared for a scenario where we don't eradicate it 100%, and where there are recurrences, where hotspots occur in different parts of the world, in different parts of the country even, and we need to be able to jump in with masks, with vaccination, but also with treatments. Keep in mind, rough number, 15% of the time, the common cold is caused by a coronavirus, right? It's a coronavirus, not like the SARS-CoV-2 coronavirus. It's not one that causes hospitalizations, typically going in the ICU, going on a ventilator, and tragically dying. It causes the common cold. And we've lived with this for centuries. We've lived with it for centuries. Coronavirus, rotavirus, other rhinovirus, other types of viruses cause the common cold. If we have effective treatments that can turn this SARS-CoV-2 virus into the equivalent of the common cold, that in itself is huge progress. Because at the end of the day, if we can keep individuals from getting sick, if we can keep the vulnerable from coming in, having to be hospitalized, from going in the ICU, from going on a ventilator and dying, that is enormous success. If this virus were a relatively benign virus like the ones that cause the common cold, you and I wouldn't be having this conversation now. It's all about all the mortality, the morbidity that this virus is causing across the globe that has made it what it is today.
Underneath all that you just said is this personal responsibility that you would like to see all of us take, to wash our hands, to wear the mask, to stay socially distant, to be respectful of other people's space.
Right.
I just spoke to an Ohio senator who was expressing quite a bit of frustration. His name is Cecil Thomas. He's from the Cincinnati area. He has an immune compromised child, and he cannot get other members of the Ohio legislature to wear a mask inside the seat of government, the Ohio State House. those kinds of behaviors and that stubborn resistance to those basic tenets of public health must drive you crazy.
So this is all about public health, and it's about doing what we all need to do as fellow Americans and as citizens to protect each other. We're at war with a virus, and this virus doesn't discriminate against any particular part of the population. It doesn't care about philosophy, politics. All it does is it infects human beings, and it makes a significant number, very sick, and even kills some of our American neighbors. We all together have to fight this virus. It's a fight against an attack. And the only way, the only tools we have in our toolkit are these public health measures: social distancing, wearing a mask, getting vaccinated, washing our hands. If we become infected, quarantining, isolating. Those are the things that we have to do. And if we keep on doing it, eventually, I hope we can get to the day where we eradicate this virus, if not forever, for a good long portion of time, much like the success we've had around the world with the MERS infection in the Middle East and the SARS infection that started in Asia. That's what our focus needs to be on, together as Americans, doing everything we can to fight this virus.
Let's talk about the virus vaccine. Ohio State has been central in the rollout here in Ohio. It seems as if the state is not as far along as it should be. Other states have a better, higher vaccination rate. They've not limited it to 65 and older, and quite frankly, 65 to 70 right now can't get on the list for vaccinations. Why were we not better prepared when we had all this time to have a rollout plan? Why do you think Ohio wasn't better prepared for delivering the vital vaccine to the public?
Well, I have to say, I look at this through the work that we're doing at the Wexner Medical Center, and I'm exceptionally proud of what's been accomplished in a very, very short period of time. Ohio State Wexner Medical Center was the first hospital in Ohio to vaccinate someone when the Pfizer vaccine became available on the very first day that a few hospitals in the nation. It was a Monday morning, I remember, and we had someone here from the CDC observing what we were doing. So we were starting literally in the first few hours, and we watched very carefully. And we worked through the group tier 1A, as it was called. These are the frontline hospital workers and others felt to be essential to caring for sick patients. And then very quickly, when we had the go-ahead, we moved to 1B. And the first patient we vaccinated was a 100-year-old woman who lives here in Columbus, and she was vaccinated, and we've been continuing to vaccinate since then. We've moved into the shot. We have the capacity to do 3,000 vaccines a day. I was over there yesterday, and I got to tell you, it is an operation like you can't believe. Patients, individuals from the community are moving through that line. They come in, they get vaccinated, they're asked to wait for 15 minutes to make sure they don't have a reaction to the vaccine, and then they move out. It's extraordinary. And as we get the go-ahead to vaccinate other parts of society and the population, we continue to do so. This week, we're starting with our 65 plus population. Of course, K through 12 teachers. And we're looking forward now to vaccinating other groups as well in the coming weeks. The more vaccine we can get our hands on, the more we're going to vaccinate. Right now, we have the Pfizer vaccine, the Moderna vaccine. We're looking forward to hopefully the FDA gives emergency use authorization for the Johnson & Johnson vaccine in the coming days. Then we look to get that allocation as well. And as you know, that's a one-shot vaccine as opposed to two.
I'm going to take you back in time again to the early part of this crisis. Walk me through what was happening at Ohio State University Hospital. You have a colleges there as well, but you've got the main center is the Wexner Medical Center. What were you doing to prepare your medical staff and to work with the community to say, we've got to get ahead of a crisis?
Right. Great question, Colleen. Very early on, it's almost hard to imagine now. We're talking just about a year. We were reading the reports about what was happening, for example, in New York City, and just the number of individuals that were becoming infected and being hospitalized. And as you remember, but it was almost a year ago, there was concern that the entire health system in New York City would collapse just under the huge number of patients that were becoming COVID positive, had to be hospitalized, go in the ICU. There were fears that we would run out of mechanical ventilators. That was the picture then. So what did we do here in Columbus? So first of all, at the Wexner Medical Center, at the time, in the very first few days, we had access to 40 COVID tests a day. 40 a day, that's all that was available. And we'd have to send them out. And we said, look, that is not going to work. So we got together at the university, including with those health science colleges that you mentioned, and we built and partnered, by the way, with Battelle across the street from the Med Center, and we built our own testing facility. We brought together testing machines. These are these PCR machines from Battelle, brought them over to the Med Center, and we scaled up to the capacity to do 4,000 tests a day. 40 tests, we went from 40, which we had to ship out, to doing 4,000, the opportunity to do 4,000 at the Med Center. The next thing we found out is we couldn't do 4,000 a day. We didn't have enough reagent to run the machines. We worked with Governor DeWine and his administration. He was an enormous advocate for us to secure us the reagent to run the machine. That's like the gasoline to run the engine. And that made a huge difference. And then we found out that we didn't have test kits to actually do the swabs that was necessary to put in the machine. So what did we do? Why? Because a lot of those swabs were made, believe it or not, in Italy, in northern Italy. And you remember what was going on in northern Italy early in the pandemic.
Yeah, they were worse than us.
Tragic. So what did we do? We went over to the dental school and we, quote unquote, borrowed some of their 3D printers that they used to make, teeth and implants. And we used those machines to make our own swabs. We got the design, and then we had to go out and make our own viral medium to put the swabs into, because you have to preserve those swabs if you're going to actually run the test. We got the recipe off the internet, and our folks at different colleges got together, and we started making our own viral transport media. We got so good at this that we were actually sending the viral transport media across the state and out of state. I remember one day I got a call from the city of New York on a Saturday, and they asked us if we could send them viral transport media. And we did, and we sent them the recipe, and we sent designs for how to do 3D printing of those swabs. So I was just so proud of how we were able to bring the scientists, the researchers, the engineers from across the university and at Battelle together to develop these really innovative solutions that had a huge impact on all the communities we serve, on the state of Ohio. As the Ohio State University, we have that responsibility, but even across the country. And that was just enormously gratifying. And it speaks to what's in our DNA here, our core, which is innovation, continuously innovating, because it's so extraordinarily important. Fast forward now to today, another big challenge around the country is treatment of those that are infected with the COVID virus, who now become increasingly sick and potentially could wind up in the ICU or on a ventilator. There are some treatments available. They're called monoclonal antibodies. Well, we set up a facility to give patients who are COVID positive and becoming sick, who meet the criteria, the FDA criteria, monoclonal antibodies. And we have already infused over 1,000 individuals with monoclonal antibodies. That's an extraordinary track record. And we believe that a number of those individuals have been significantly helped, and they've avoided and averted an admission to the hospital and into the ICU because of this work. So it's this focus on continuing to innovate, continuing to be at the cutting edge, and to do things quickly, not to wait. When we got together with our colleagues at Ohio Health, Mount Carmel, at Nationwide Children's early in the pandemic, we said, we're all health systems here in the greater Columbus region and central Ohio, but what can we do to collaborate? We Let's work together. It's embedded in the Columbus way, finding ways to partner and collaborate. So we didn't wait for the federal government to tell us to do this. We didn't wait for the National Guard to come in. We worked with the city. We took over the convention center. We were able to put 1,100 beds in the convention center early in the pandemic, such that if Columbus turned into the next New York, where all the hospitals got overwhelmed, we would have a place to admit patients to. And the great news is we built this whole thing out and we never had to use it. And someone said to me, well, do you feel bad that you spent all that time, energy, and effort with the other health systems building that out? And I said, absolutely not. All of us buy insurance all the time. We never think twice about it. We were simply buying insurance that should Columbus look like New York or Northern Italy at some point in this pandemic, we were able to deal with it. And it never happened. And I'm just thrilled that we were able to work so collaboratively together across central Ohio to make this happen.
I remember feeling comforted knowing that that facility was there just in case we did become like Northern Italy. But
Yep.
in the midst of this, you're talking about the scientific and engineering response and how you collaborated to meet the basically the physical needs. But you were also leading a staff of thousands of people who found themselves in the midst of a pandemic like none of them had ever dealt with before. You had to lead people through a crisis in which you were asking them, put your own life at risk to take care of the public.
Right.
What was the feedback you were getting, and how were you managing this staff of people who we were all so dependent on?
Uh, I read an article recently in one of the newspapers that talked about the other pandemic, the pandemic of the stress that this has put on healthcare workers, just the pressure, the turmoil, the emotional challenges that so many healthcare workers have faced day after day after day. I talked to someone who, literally said that he had been working every day for over 365 days on this pandemic without one day off.
Oh
Incredible.
my gosh.
Not here in another state, but a state that was very hard hit by this, particularly hard hit, and that's one extreme. But so many healthcare workers, not just physicians, as in the case of that individual, but nurses and other staff, frontline workers, dietary workers, transport workers, workers in the emergency department in our ICUs, day after day. So, what did we have to do to help them? Well, first of all, it was the most fundamental things, making sure they had PPE. And again, if you remember early on, there were serious concerns about having N95 masks. We partnered with Battelle to figure out a system, as did other hospitals, to recycle N95 masks. But getting all the types of PPE. At one point, there was a concern about having enough of the gowns because the gowns used up a lot of fabric, much more than masks. Gloves. At one point, we were looking to purchase gloves from all over the world to bring to Columbus because there weren't enough gloves. And this just went on endlessly. Make sure we had enough ventilators for the staff to intubate and care for patients who needed mechanical ventilation. So that was just an extraordinary challenge. Two, I mentioned testing before. Imagine caring for patients and you don't even know if they're COVID positive or not. And if they are, obviously putting those individuals in respiratory isolation, making sure that you're doubly careful. I mean, we always start with the assumption that until proven otherwise, you had to protect yourself in all cases, but we wanted to know that, and we had to make sure that testing was available. But after that, it was really about the mental health and well-being of our frontline employees. we we also borrowed the Blackwell Hotel on campus as a respite for our employee. We borrowed a lot of things, Colleen, during this pandemic, but we did give them all back. But and the folks were phenomenal at the university to allow us to have access to the Blackwell as a respite for our employees. And so they didn't have to drive home. Or even if they lived very close by, they didn't want to go home and they were fearful they would infect their families. That was a huge concern early in the pandemic. So we wanted to address that. And then a lot of various types of emotional support and mental health support for our workforce to avoid all the pressures and the sequelae of what they were going through in providing this incredible care for the sickest of the sick.
I imagine, two of my neighbors are physicians.
Mhm.
The wife was on the front line intubating people at the very beginning in the most critical care floors and was afraid to come home and come into the upper part of their house where the husband was living with the daughter. She would come home, go in through the basement, change her clothes there, shower there, try to avoid her family. Psychologically, you must have been hearing stories like that of people who were sacrificing in ways they never thought they were going to be sacrificing when they chose this career in healthcare.
I think, we all know when we enter our professions in healthcare that we're committing to doing this kind of work. I think we understand that, but until you experience it, it's a very different thing. And that's why providing the support was so important. And I have to say that the community provided support. In the pandemic, we would get food shipments from restaurants and caterers who would just send incredible amounts of food. The cards, the emails, the texts, the well wishers were just extraordinary. The signs on the sides of the road. It seems like a small thing, but for that person that you just mentioned, Colleen, it made all the world of a difference for them. It showed them that they weren't alone, that they weren't fighting this fight by themselves, and that they had a whole community behind them. Because that's why we're all here. We're all here for the community.
Were you frustrated at how quickly this pandemic became a political football? That suddenly people were lining up and saying, well, it's a hoax, it's going to go away. Science is saying one thing, politicians are saying another thing, and you were caught in the middle.
I haven't had, honestly, we've been just so deep in this now for almost 12 months. I haven't really had a lot of time to think about that or process it. It's going to be something I'll look back on to really understand how it did get so polarized. I'm looking at it from the perspective of a pulmonary doctor, a critical care doctor, someone who is on the faculty in the College of Medicine and in the College of Public Health, and as CEO of this large enterprise here. And I'm sure that myself and my colleagues, when we're on the totally on the other side of this pandemic, are going to look back and try to understand those various dynamics, because right now it's a puzzle to me, and all we want to do is help people. We want to prevent them from dying. We want to keep them out of the hospital, and we want to get back to normal. That's what we want to do. And we'll have a time afterwards to try to reflect on that. I think there are issues, without a doubt, that have a lot to do with other factors besides healthcare per se. And we know that health and well-being are dependent not just on on health, but also on mental health, financial well-being, social connectedness, having a job, financial security. These are the things we call, social determinants of health, behavioral, environmental determinants of health. They all have an impact on our health and well-being, and they even have an impact on us living a full life and not dying a premature death. We know that communities where there are enormous social factors, so transportation, housing, food insecurity, financial well-being, education, for example, where those are challenged, where they're diminished, those communities will in fact have a greater likelihood of dying a premature death and individuals having poorer health and well-being overall. So there are a number of things we have to address, and I'll just put this out as well. When we do, as we do get to the other side of this, we're going to have to be prepared for a number of social factors that we've talked about before, but I'm concerned we're going to see to a more significant degree. Take, for example, opioid abuse and
Mhm.
and overdose deaths. We're already seeing during this pandemic, because of the social isolation, with the pandemic, we're seeing an increase in these opioid deaths that are occurring. People are isolated, they may not have a job, they don't feel socially connected, they may feel like they don't have purpose per se, they may not be connected to their families. So what does this do to them? And it raises the issue of the things that we have to do as health systems, as community organizations, as universities, to address multiple determinants of health, because we're going to have to deal with these challenges on the other side of this pandemic.
I just read this morning that there is an increase in liver disease that they believe is tied to people drinking so much more during isolation. So you are dealing now with new emerging healthcare problems. You are certainly dealing with managing this massive hospital system during a pandemic. You came into this position fewer than 5 years ago, not knowing what you were going to be facing a few years down the road. How do you think this will change the way you lead in the future, or will it?
Well, to be precise, I've been here now a little over a year and a half ago. I got here in June. I think it was June of 2019. I was here for about 6, 7 months before the pandemic started. Um,
Welcome to Columbus.
Thank you. And I have to say, so I came here because of the extraordinary opportunity at Ohio State and to lead the Wexner Medical Center, and just our vision for this organization, which is to be the academic health system of the future and to do things in really innovative ways that create a platform for us educating the next generation of health professional. If you take those 7 colleges, we have 10,000 students here at Ohio State being educated in the health professions. And what I've been so passionate about is, can we take this med center, which is a large health system, and turn it into a health platform to literally reach into the homes of individuals, to keep them healthy, to address social and behavioral and environmental determinants of health? Can we develop interprofessional teams of these different health professions to do this effectively? That's where the future really is. When I first got here, we were doing 50 telehealth visits a month. We now are doing roughly 2,800 a day. So we've really been moving very quickly from being that traditional system to becoming this health platform of the future. We now have artificial intelligence that interfaces with our patients when they go to our website. We're using digital solutions. We have mobile vans going in the local community. These are all the things that everyone has seen in other sectors of the US economy. And I think it's due time that we see this in the healthcare sector as well. So that's what I've been so passionate about. I'm very lucky that I had 6, 7 months to get grounded here. I spent most of that time really um, getting out in the community, meeting with leaders, meeting with individuals, visiting different parts of the greater Columbus region to understand the needs of the community, and getting out across Ohio State University and the Wexner Medical Center to spend a lot of time with our faculty, our students, and staff. We have roughly 27,000 individuals that work at the Wexner Medical Center. And I really wanted to spend that time with them and then develop this strategic plan and this vision that I just told you about. But to answer your question, what I've learned is what I knew before. I just learned it even, 10 times more. You have to develop a vision for the future. You have to develop a well thought out plan. And then you make sure that you have the smartest people you can who own it and are responsible for carrying it out. because if they're successful, it'll get done. If the focus is on implementation of a plan, putting it in place, all these remarkable things that I talked about, setting up a COVID test lab, doing the monoclonal infusion facility, setting up the shot, running all those ICUs. I didn't do those things. Those things were done by incredible individuals that had the freedom to make the right decisions, to do what to do the work they were hired to do, and do it in the larger context of our overarching vision and strategic plan. Early in my career, I used to run a medical intensive care unit, and I share this story with a lot of our leaders here. You know, in those days, I was paid to be a micromanager because patients' lives depended on it, making decisions in real time with limited amounts of information, and going very deep and really owning every decision. You can't run a 4 billion plus operation that way as a micromanager. What you have to do is you have to hire, recruit, and retain the smartest people you can, make sure they share and understand the plan and how to implement it, and then you go out and get them the resources they need to make it a reality, and it will take care of itself, quite frankly. And I'm just so proud of the people we have here. It's all about our workforce. It's about their dedication and their desire to really address the opportunities that lie before us that has resulted in the things that I've seen here.
It's almost as if the pandemic accelerated your plan. It forced your staff to prove its ability to respond in a crisis, and it also allowed you to move the health system into areas that you only envisioned but suddenly needed.
That's like so well said. Early on, we used to talk about flattening the curve of the pandemic, as you recall. And I used to say that for a decade, we were flattening the curve of technology in healthcare. Everything that we're doing today could have been done years ago, just like in every other industry, every other segment of the economy. But the way that healthcare has been delivered has been quite traditional, frankly. And what this pandemic has done is really taken the the flattening off that technology curve, so to speak. And now we're seeing this evolution, a rapid evolution in new ways of delivering care, really utilizing a lot of these very innovative approaches. And I think for the institutions and the organizations, particularly ones like ours, powered by this phenomenal university, that is willing to grab that innovation and put it directly into the health system, the delivery system, there are going to be huge opportunities to have a much more efficient way of delivering care, to create higher degrees of patient satisfaction, and to do things that are really going to be novel and innovative. And I think that's what we all want. We want different experiences. We calculated just during the pandemic, by moving to telehealth in the way that we did, how many miles of driving our patients saved, how much gasoline was saved. I mean, who wants to leave their home, drive on one of our, great expressways here in Columbus for 20, 30 minutes to go to a parking deck, go around the floors up to the sixth floor, to walk across the bridge, to go in a waiting room, to wait to be seen? If we can do that same thing in your home over your computer, your iPad, your iPhone, whatever device you use, if we can create the same results, all of us would choose that. We all choose that in other sectors of the economy. Now, you're probably going to say to me, I noticed that you're building this huge outpatient facility in New Albany. You're building one in
Yes.
Dublin. You're building one over on West Campus as well. Three of these huge outpatient facilities. They're nearly 300,000 square feet. So what are you doing? And by the way, you're building a $2 billion hospital bed tower when I just got done telling you about a new world. So the answer to the question is, we believe that there are a lot of things that can be done over virtually, digitally, but at the same time, as we increase access, we have to figure out ways to deliver more and more of the inpatient care in those outpatient settings. Those outpatient buildings, like in New Albany, have operating rooms in them. If a patient has a choice between coming in the morning, having all their needs met in one of those outpatient buildings and getting to go home in the evening versus spending 2 or 3 days in the hospital, I don't know about you, but I know what I would choose. Now, at the same time, we are building this new tower to replace the old building here in the middle of the Wexner Medical Center campus, and we are adding over 400 beds. And the question is, why are we doing that? Well, we believe that many community hospitals out in the periphery are going to probably move more and more towards being those outpatient buildings. And ultimately, we're going to see less hospital beds across Ohio and across the country, number one. Number two, when you need one of those inpatient hospital beds, it's going to be for really sick people. Because if you're not that sick, we'll take care of you in the New Albany building or Upper Arlington building or wherever. But if you need to be in a hospital, like the James, for example, if you need an organ transplant, which we're one of the leaders in the country in doing organ transplants, or if, God forbid, you're a burn patient, and we have one of the burn patient units for the entire state here, you have to be in a state of the art facility. I mean, we learned this during the pandemic when there was a concern that Ohio would run out of ventilators, would run out of ICU beds. We need a state of the art modern hospital that, in fact, has much, much more capacity for ICUs, for ventilators, and to care for patients in negative airflow rooms where whatever they have can't be spread to another patient. And I truly believe, and I am really passionate about this, that if you live in Columbus, you deserve the same state of the art facility that you would find in any major city, be it New York, Boston, Philadelphia, because that's what we deserve here in the state. And we have a responsibility to build those buildings to offer it to our citizens.
I think it is remarkable the hospital systems that we have and that we are blessed to have in central Ohio. I could talk to you forever, but Katie Smith, who is the executive, the CEO of CEO Magazine, the editor, is joining us now because Katie gets to ask you a question too before
Great.
we wrap up. Katie, what have you got to say to us today?
Hi, Hal. Um, Many of the leaders in Columbus had a really stressful year, and I would imagine that you are chief among them. And can you share with our other leaders, with your fellow CEOs, how did you maintain your personal resilience this year? What did you do to not just lose it every night and every day? Because what I hear you describing, all the moving parts, it's incredible what you and your people have accomplished.
Okay, thanks for the question. Last week I met with a number of our students who are in a leadership program in our College of Nursing, and they asked me the same question. And what I told them is this: number one, you must take care of yourself. If you don't take care of yourself, you're not going to be successful in taking care of anyone else, and that includes your family members or the patients you're responsible for. So I truly believe that. I'm very lucky. Going back a couple of decades, I committed myself to doing 1 hour of physical activity a day. That meant going to a gym 3 times a week. That unfortunately stopped. I guess it was back in February, March. I'm losing track of time. A year ago. It's hard to believe. I haven't been back to a gym in a year. It means that the people at Peloton got me to buy one of their bikes, and I've been, a runner and a power walker outdoors as well, and doing that on a daily basis. And I do it, rain, sleet, or snow. It's really important. Number two, trying to read at night. Read books that have absolutely nothing to do with my day job. I think is really important, and that's just about Hal. But I would say equally important is family. I'm blessed to have a wife who understands these challenges. She's exceptionally supportive. It doesn't hurt that she is a licensed clinical psychologist and therapist. But having that relationship is really important to be with family. Unfortunately, a lot of it now is over Zoom and FaceTime, but nonetheless having that contact, because that's what grounds you and that's what keeps you, frankly, sane. So I would say that taking care of oneself and really purposefully devoting time. We've offered mindfulness training for our workforce here. We've encouraged yoga. We've encouraged all these different approaches that are structured to help individuals focus on themselves and on their well-being. It's really, really important.
Before I let you go, I can't let you go without asking what everyone wants to know. Where is this vaccine program going to go? Are you optimistic that most of us will be vaccinated by summer?
Yeah, I don't have a crystal ball, but I am very optimistic that as more and more vaccines come online, as companies like Pfizer and Moderna start to manufacture even more, as Johnson and Johnson brings their vaccine forward, again pending approval by the FDA and other vaccine manufacturers. We were looking early on in the pandemic at 8 different vaccines, and there are even more globally that we will have a lot of vaccine. Where we have the responsibility is to address individuals that have vaccine hesitancy, and we're doing a lot of work in our local communities, making sure that we can encourage everyone to accept the vaccine. We've seen steady progress both here in Ohio and nationally in reducing the number of individuals that are saying they won't get the vaccine. And over time, we're hopeful that we will have an exceptionally high acceptance rate. It is so important to stopping the spread of the virus. When we stop the spread of the virus, we reduce the ability of the virus to mutate. And if we can stop it from mutating, that means that the first line of vaccines that have been made to date will be absolutely effective the way they were intended to be effective. If it does continue to mutate, then these manufacturers have already said they'll go back and they'll have booster vaccines. And it sounds so novel, but if you stop and think about it, Colleen, all of us, are encouraged to get a flu vaccine every year. All of us are told that our tetanus vaccines need a booster every 5 years. Kids that get vaccines for childhood illnesses are reminded about their boosters, and even adults go out and get a shingles vaccine, which is basically to give them a booster against chickenpox coming back in the adult form, which is called shingles. So we've been doing this for decades, for decades. It just seems so new and different because it's COVID, but it's really not. It's really not. Let's try to get every American to accept the vaccine unless there's a reason why they can't take it. And let's really stop this thing cold in its tracks.
One final question. What book are you reading right now?
So one of the books I just finished, well, I finished one. I realized I just broke my own rule. One of the last books I read was about the Spanish flu pandemic, but it was very, very interesting. A Gentleman in Moscow, a great novel, has absolutely nothing to do with the pandemic. Wonderful writer. I would really endorse that book. It's a wonderful novel, Gentleman in Moscow.
All right. Thank you so much for being with us, Doctor. It's been a pleasure, and good luck to you and your entire staff in keeping the rest of us safe.
Thank you, Colleen. Really enjoyed talking with you today. Have a great day and be well.
And we want to remind the people who are viewing in, if you would like to know about future programs, you can go to columbus.org/events to keep up with what the Columbus Chamber has in store for all of you. Thank you, Doctor.
Thank you.